Good afternoon, everybody. Thank you so much for spending the time this afternoon to join us and participate in today's webinar. My name is Steve Wagner. I'm the Associate Vice President of Workers' Compensation at Workpartners, and we're going to go over some information about our product and hope you enjoy today's discussion. Next slide. So who is Workpartners? We are a part of University of Pittsburgh Medical Center, which is a large global health enterprise in Pittsburgh, Pennsylvania. We provide health and productivity solutions for many, many companies throughout the United States. Workpartners, and I will go through a timeline here in just a few slides, was formed in 1997 to handle ourselves, University of Pittsburgh Medical Center, and handle specific items for our own employees. We have grown over the course of time. Now we are over 700 employees and in over 38 states. Multiple products exist within Workpartners. Workers' compensation, which we are focusing on today, is what we will be talking about. But in addition to that, we have an absence product, life solutions product, e-benefits, and analytics product. So currently have offices in Pittsburgh, Pennsylvania, which is our home office for our workers' comp. And then also additional offices in Loveland, Colorado, in Cheyenne, Wyoming. UPMC has over 96,000 employees. The workers' compensation team has grown considerably throughout the course of time. Back in 2010, we had about 30 employees within workers' compensation. Today, we've grown and prospered and have over 165 employees in the workers' compensation division. Next slide. So I'm not going to go through every specific date and timeline on the page here, but as I had indicated, in 1997, Workpartners was developed. One of the key components of what we do is we handle the employees and any coverages that we needed to for University of Pittsburgh Medical Center. With that being said, the workers' compensation product, was developed to be a third-party administrator for ourselves, and then eventually transformed into being a carrier for external self-insured clients. Based on the successes that developed, Workpartners ultimately became a part of UPMC Insurance Service Division in 2006. As we progressed, our president decided that, hey, it made a lot of sense to not only be an expert in the TPA space, but also to develop a commercial, fully insured workers' comp product. So we did launch in 2010 and opened our doors July of that year and began writing fully insured workers' comp coverage for employers in Pennsylvania. As time progressed and we started to broaden our client base in Pennsylvania, we decided that it was time to expand and take our carrier expertise into different jurisdictional regions. In 2018, we ultimately opened in Delaware and began our expansion plan with Pittsburgh, PA being the home office. Time progresses and ultimately went into multiple other states, with the latest being in 2022, where we opened in Florida, Virginia, and DC. Next page. So with our carrier expertise, there are many things that we need to control for our employer groups. And this has been a key indicator in the success of our program. We have a vast amount of expertise in our workers' compensation program. We have many, many departments that make up our workers' compensation team, years of experience, and we continue that recruitment effort to make us successful. We do also provide risk control services and injury prevention to provide solutions to employers who need assistance, not only from a risk mitigation perspective, but also evaluating our clients and what the trending analysis may indicate. We do it on a case-by-case basis and understand where the needs are and focus our efforts on safety. In addition, we build in strong medical cost containment and return to work programs. So from a medical management perspective, we have a host of nurse case managers that are involved in evaluating each and every claim that comes in the door, making sure there's compliance, getting people back to work according to the ODG guidelines, and then controlling medical expenses as bills come in the door. We continuously are negotiating and building networks that reduce medical bills below workers' compensation fee schedule. In addition to that, we have an internal medical bill review department that evaluates bills that come in the door and are actively negotiating with providers to control medical expenses. In addition, we work very closely with our clients on developing a return to work program to get people back to work as timely as possible and build out specifics with vocational specialists to evaluate a client's capability to bring people back to work sooner than if they did not get released to full duty. Partnerships are very key to the success of workers' compensation injuries. It's not about Workpartners just coming in and being your carrier. It takes the buy-in of the employer and the agency to be successful. We escalate things to make sure everybody is on the same page and build the best outcomes possible when work injuries do occur. Our outstanding service has built into a very strong client retention rate, which makes up 93 to 94% retention on our clients. That does not go without strong relationships and strong partnerships, as I have indicated previously. Next slide. And as I had indicated previously, just wanted to showcase to you where we are at this point. Currently, we are in Pennsylvania, Delaware, Maryland, New Jersey, West Virginia, Florida, Virginia, and DC. Been very successful in our expansion, but with that, we are going to continue to expand and diversify our product. Future states that we're currently reviewing: Tennessee, North Carolina, South Carolina, Georgia, and Kentucky. Not something that's going to occur just in 2024, but we're probably projecting some expansion in 2025. With that, I'm going to turn it over to Greg Greif, who's going to jump into the next slide.
Thanks, Steve. So my name is Greg Greif. I am the Senior Director of Underwriting. I oversee all the underwriting operations. Been with Workpartners since 2010. That's when we originally launched, and I was part of the team that launched the product. And Steve Wagner as well was a member of that team. Just so everybody's aware, we do have a Florida underwriter. Her name's Dawn Reed. She's located in Florida. Dawn's got over 30 years of experience, and if you have the opportunity, reach out to her, ask her any questions, and establish a relationship with her. So I'm going to talk a little bit first about our book of business. Um, we write a wide variety of business. As you can see from the slide, about 48% of that, almost half of our book, is healthcare related. That wasn't initially by intent. I think when we started in Pennsylvania, everybody associated us with the UPMC hospital system and the health system. So our agents just kind of sent us health related business. We're very good at it. And I would encourage you to send that sort of businesses to us. But we certainly have, we're looking to round out our business, diversify it. We write generally low to moderate hazard business, but again, 150 classes of business. Some examples of the types of business we write on the social services side, we write a lot of that. Retirement homes, nursing homes, YMCAs, rehab centers, early intervention programs. We like professional services such as law firms, doctors' offices, veterinarians, manufacturing, always looking for that, just about any type of manufacturing, from plastic and rubber goods to paper to textiles, machine shops, metal fabricators. Like we can do retail, automobile dealers. We got a large book of that business. Grocery stores, department stores, pharmacies. And we will also write things like wholesalers, beverage distributors, lumber and building materials distributors, plumbing and electrical supplies, fruit, vegetables, any sort of distributor we will entertain. On the service side, we'll do things like janitorial and building services. On prevalent in your area, hotels, resorts, golf courses, we'll write those as well. Along with the manufacturing, I mentioned the hard goods. We'll also do food products such as candy, dairy, canning, bakeries, breweries, beverage manufacturing, and we've got a large book that revolves around education. A lot of school districts, colleges, universities, cyber schools, private schools, vote training, things of that nature. So we are willing or want to diversify our book. So if you have any questions, please just pick up the phone, give us a call, talk to your underwriter about if it's something we're interested in or not. That dialogue is so important. And if there's certain things that are unique about a risk that might otherwise exclude it, we're willing to listen to those stories. For example, if you have maybe a piece of business with a high experience mod, a lot of carriers might walk away from that just based on that mod. If you can give us a story there that the client has invested in safety and they've implemented X, Y, and Z, we need to know that, and we may be willing to write that sort of business. Next slide. So we have, everybody knows Florida sets the rates for the class codes. So you got to differentiate yourself. The way we do that was with our rating plans. We have several types of filed dividend plans. We have both flat and the sliding scale dividend plans. For the small business, that is up to 25,000 in business, we offer a flat 10% dividend. For those accounts above 25,000 in premium, it can be 10, 15, 20, or 25,000 in dividend percentage. Those are primarily driven by the number of risk management controls that risk has in place. We also offer a sliding scale dividend that offers up to a 40% dividend based on loss experience. another item I wanted to touch on was our straight-through processing. And Lauren's going to go through our portal and tell you about that. But basically, our straight-through processing allows you to quote, bind, and issue a policy essentially probably in less than 5 minutes. There's over 100, probably closer to 150 class codes that are deemed acceptable classes that are eligible for our straight-through processing. You answer maybe 4 or 5 questions tops, depending on the class of business. It's got a favorable experience mod, and you answer a couple questions. You can all do that on our platform. It's very quick, very easy, and it's all at your fingertips. And lastly, our minimum premium is $750. All right, that concludes my piece. I'm going to turn it off to, is it Lauren next or Susan?
Susan.
Okay, here you go, Susan. Thank you.
Hi. Good afternoon, everyone. Thank you for joining. My name is Susan Straparo, and I am the manager of field operations at Workpartners. And as Steve and Greg mentioned, we are a monoline workers' comp carrier. And we see a lot of healthcare, social service accounts, nonprofits, education. We're writing more and more manufacturing, wholesale, distributing. Our largest segment is home health care, but we are a generalist as well. We see a lot of auto repair shops, machine shops. We love small business. We currently have a 94% retention rate here. So that is way over average compared to other insurance carriers. And our overall combined loss ratio is 85%, which is way under industry average as well. So now I'm going to turn it over to Lauren, and she's going to discuss how to quote a piece of new business with us.
Thanks, Susan. Hi, everyone. I'm Lauren Bedeca, and I'm the Territory Marketing Manager for the Florida region at Workpartners. And I'm just going to kind of high level go over our portal and how to submit an application. So once you get signed up with us, each individual will be granted access to our portal. And once you get logged into the portal, this is going to be the dashboard. And over to our left, we have a few quick links. So I'll go through those fast. So when you get some business with us, there'll be some stats here where it says applications by month, some different graphs you'll see. From there, you're able to hit in 2 different spots, to the left where it says applications, and to our top right where it says I want to. And this will be where you can submit a new application to us, as well as seeing the list of applications that you have already submitted. Below this, it's your book of business. So once you get some business on the books, all policies will be listed here. You're able to click on each individual policy and go into detail with the billing, different endorsements. You can pull the policy issuance from here. So that gives you a good bit of information on each policy. Underneath this is the renewal quotes. The underwriters will usually get the renewal quotes in there for you guys about 60 days prior to the effective date. So you're able to go in there and pull the information you need for that as well. In our document section, this is where you'll be able to see endorsements, the policy issuance again, cancellation notices, and documents of that such will be stored in this part. So next we have our reports. Each individual will be able to pull the following reports. So your agency book, detailed loss runs, and all applications that you have put into the system, you're able to pull a report from here. And lastly, on this part, it's our resource tab. There is a ton of information stored in here for you all, starting with our safety resources, to claims resources, to different agency resources, which would be some supplemental applications that the underwriter might have you fill out, marketing materials we have stored in there for you guys. There's different how-to guides for pulling reports, and even for submitting an application. This is all stored in the resource section. So now I'm just going to go ahead and briefly go over how to submit an application with us. It's a pretty easy and quick process. So again, you can either hit the application part and submit application, or the I want to and submit application. So this will be your first page. It's just general information on the risk. All boxes in red will need to be filled in, and all questions will need to be answered in order for you to go to the next screen. On this portion, the information that you first input on the first page, it will populate into this add state. You'll hit add state, and if you need to add more than one state, it will be on the next screen for you. All of our states that we're currently writing in are already built in the drop down for the state, so you're able to pick from there. On this screen, you'll put in all payroll information. So pretty self-explanatory, just throw it all in there. This will be the loss history. So you'll be able to pick what's applicable to the submission. If there is no loss history, obviously you'll choose no loss history, or if there is prior loss history, you can go ahead and select that. So this will be all of the account information, from the corporate contact to the business type, and just different information we'll need on the risk. You'll want to make sure all, again, red boxes are filled out, as well as the corporate contact, location contact, and claim contact all need to be filled out as well. The corporate contact will populate down to the other two fields where you can see where it says location 1. You are able to change that within if there are different contacts. So again, all that has to be filled out before you can go to the next screen. From here, you're going to go ahead and add all your officers as needed, and then hit next. And on this screen, there's just a few underwriting questions. They're all in yes already, and then you can just kind of change as needed. Dawn Reed, your underwriter, may also ask you additional questions, but just be sure to fill all of that out before you go to the next screen. And after that, oh yeah, there you go. You'll be able to pick your billing statement as well at the bottom of that screen. So after all that's done, you can attach any additional information, any notes to the underwriter, loss runs, and you're also able to choose your limits here. If you have any final words you would like to say to the underwriter before submitting, you can throw it in there, and then you will hit submit for review. So you'll be giving us all this information, but as I previously said, Dawn may ask for additional questions. She will follow up for loss runs if anything's missing. So we'll be sure to cover all bases if you forget something in this process. So that's pretty much the whole application process. It's very simple, as I said. And after that, you'll hear from your underwriter within 48 hours on where this risk stands or if there's any additional information needed. So that's that portion. And Autumn, Heidi, I don't know if there's any questions in the chat for us that we need to answer.
I have not seen any come through thus far.
Perfect. So I'm not sure if Steve, you have any closing words you'd like to say before we head out?
Yeah, I just wanted to, again, thank everybody for their time today. We look forward to the partnership. We look forward to the opportunity to show you what Workpartners is capable of doing. As I had indicated earlier in the presentations, it is truly a partnership approach to things. It's just us not running rogue, being a workers' comp carrier. It's us working together to find a solution and grow a book of business and help be a solution for the employers that need assistance. So with that being said, look very forward to next steps. And at any point, if you guys have questions, please feel free to reach out to us.